Hi, this is Anna from Health and Stability Spinal Care and the Contour Program. I'm here with Miss Jan today. Miss Jan, we are treating you in our office for both neuropathy and with our contour light to loosen inches on your body. So when you came into our office, you started, of course, in about July this summer. So we started with you. And with the neuropathy, you said you were having like grabbing pains and sharp pains that are going on, a lot of them in your shoulder area as well as your feet. And then with the contour light, you were having a lot of digestive issues that were going on. Describe some of those, if you would, some of the digestive issues that you were having.
There was just a lot of healthy food that I would eat it, and then my stomach would just start grabbing, and I knew it was upset, but it started and it got worse where I was not able to keep the food down a lot of times. And like I said, it was healthy food, and I had eliminated spicy food and those kind of things, and it was a lot of vegetables, and it just kept getting worse, and I thought, no, something's wrong here.
Yeah, that doesn't sound right at all. I know you came in, you began, your pain level was about an 8 out of 10. That sounds right. I know you mentioned also that you felt kind of like your life was stagnant for you. It wasn't moving forward. It was just kind of like a plateau. It was just staying there, right? So when we came into, and you came in, we started you on a neuropathy with our class 4 laser. We also did the Trust Your Gut program. So tell us a little bit about that program.
Well, Trust Your Gut is, and I track the food, and it's pretty straightforward out there, kind of how you need to follow certain foods that you should exclude, and they pretty much give that to you. They're still encouraging you to have a couple of healthy meals a day, and portion control is always the big thing too. And it does eliminate, they're really big on the vegetables and the fruit and the lean meat, and that really does make a big difference. And I know the times I'm cheating, I pay the price. Because when I say that, when I say cheating, I'm not saying you go off for a whole week or whatever, but you know, that one meal or whatever, and you can just start feeling it in your body, how it just kind of weighs you down. So
what's your new normal like with your digestive system?
My new normal is I can eat certain vegetables and the lean meat and not get bloated, because you have to watch for the portion control. And I can get up and, walk away, or, I don't constantly think about the food I ate at the meal anymore.
Good, that's great. And so since July, we measured you today, actually, and we got you your numbers. So how many inches have you lost today?
About 19 and a half inches.
Which is really good.
In 2 months, about a little over 2 months.
So how does that feel in your body? Can you tell a difference in the clothes?
Oh my goodness. Yes, it does. The clothes fit a lot different. And the one thing that I have been doing, and my friends here say, don't be so dependent on that scale. You get on there and think, I've got to lose these pounds. What is happening is my body is shifting, and yes, I'm losing about a pound a week is what it boils down to, and I'm thinking, well, shouldn't it be 15? But I feel so much better. And if the inches are shifting and moving, that's key also. Many times people will lose weight, and yet the inches, the fat still just kind of is still in your body, and you haven't eliminated it, and so then you have those issues to contend with. But this is working.
Good. So was the Trust Your Gut program difficult for you to incorporate with your lifestyle?
No. And because I'd already, and like I said, I was a big vegetable person. I love potato chips too, but I don't do that anymore. But I'm just saying, you start getting used to what your body is comfortable with, those kind of things. And since, now there was some food on there, I'm not into elk and deer and all those kind of things, but I've always been lean, and like I said, the vegetables, there were some vegetables that, well, I don't know,
Were there any that surprised you that you thought, oh, I didn't know that could be a problem?
With my body, yes. Because I was big on tomatoes. I just love tomatoes. I just loved peppers, the green ones, the red ones, you know, the yellow ones, and thinking, well, you know, for the most part, though, that's just pretty healthy.
Right.
Not for me, it's not.
Right.
And the key, when you get on that trust your gut, the one thing that, and I've still got the last phase to get completely through there, but they let you introduce a food back in, kind of one at a time, because a combination of those foods can be causing the problem as opposed to just the one.
Right.
And so, and like I said, I walk around eating raw peppers all the time, things like that, and I just love those things. And so I really haven't gotten to the point where, I mean, I know when I've had a salad that have both in them, that kind of thing, things don't feel quite right. And so that, like I said, it's really surprised me. I always heard carrots pack a lot of calories, but carrots are okay on the diet and everything, and they really set pretty well with me.
Good. That's wonderful.
And so do cucumbers, you know, and those, yeah.
Sure.
So
how's your pain level since we've been treating you with the neuropathy? What have you been able to tell?
I came in here with, I had a complete shoulder replacement on my left side back 1st of February, and am I right? And I have pretty bad cartilage issues there, but my point being is, they both got to the left one, it was just kind of a dull ache that was there, you know. I mean, I'd gone through physical therapy and those kind of things. The right one in my mind, I'm not having surgery on this one, but it was just a constant throb in my right one. And it interfered with my sleep, and basically I was worn out most days. I had a high level of fatigue just because, you know, pain could be a lot worse than what it was, but...
You said you were expending a lot of mental energy trying to ignore the pain and just carry on with your life.
That I can do this, I can do this. But then a friend recommended, well, go see Dr. Nick, and the rest is history. All this kind of started fitting together. My pain level now is, I would put it between like a 2 and a 3, mostly a 2. I sleep, it doesn't interfere with that. The time that I think that, okay, I lift something, I should have been lifting it in the first place. I mean, you know, then that kind of thing. But it just, and what Dr. Nick is doing far as looking at it, and he was very, very honest. I can't put more cartilage back into your arm, those kind of things, but his focus was to get my spine straightened out. And it's unbelievable because he did an x-ray and I saw where my spine was going and those kind of things. Moving back, it does make a difference. And by adjusting the fat that I was carrying, the digestive things I was having, and arms are kind of settling down, you know. And the one thing with the Contour Light, and I've said this, kind of taking care of fat, but it helps my joints too. I feel pretty good laying there for 20 minutes and yeah, pretty relaxed.
So would you recommend this treatment to anybody else?
Yes, I would.
Absolutely.
I would, yeah. They really need to check this out. This is nothing, I've had excellent doctors. This is nothing against, I had excellent people working with me at physical therapy. It's nothing against that, but just don't rule this type of situation out either, because it might be really work for you.
Excellent. That's great. Thank you so much, Ms. Jan. I appreciate you taking the time to talk with us today.
You're welcome. Yeah. Good place to be.
Thank you.